as a hinge joint or any other kind of joint.
Or your foot can't.
Yeah, if you were going to analogize it to the wrist, you'd call it an ellipsoid joint. Okay? But it doesn't have that range of movement, does it?
Yes.
And if you fit this down here and fit it in there, boy, it sure hinges pretty nicely.
How do we turn our feet to the side then, sort of?
My ankles, I can tilt them, cant them to the side just a little bit.
I don't think all that articulation's happening right there, though. There's a lot of other
Yeah.
articulations. that make-
Articulations.
Seems
I'm
like-
talking about strictly my ankle.
Right.
But I'm just being the devil's advocate because I would, in the same breath, I would call this a hinge joint. A hinge joint, you shouldn't be able to cant it side by side. So maybe I've worn my ankle out, which we know for a fact is true. Is maybe that's why it goes side to side. Maybe yours doesn't. Okay. But it sure doesn't, it looks like a hinge joint to me when you look at the squared off corners there. Okay, see that? Because that's the articular surface right there. It articulates, yeah.
The calcaneus.
Okay, the calcaneus is your heel bone, the largest of the tarsals, and that is this bone here.
The sustentaculum tali.
Okay, sustentaculum tali is part of the calcaneus, and so remember how we showed that rear view of the calcaneus and that big shelf sticking out to the side off of the calcaneus? It's kind of hidden by the other bones here, but there's the big shelf sticking out to the side, and it does indeed help support the talus, which is just above it. It's the talus kind of covers it up, makes it hard to see. But that shelf sticking out to the side is the sustentaculum tali. I love to ask that for some reason.
The medial cuneiform.
Okay? Yeah, so we got these three cuneiform bones. Okay? Right there. And so the medial one, the most medial is by the big toe, because the big toe is medial. And this is intermediate, and that would be lateral, wouldn't it?
And then the talus.
Okay, the talus is this bone that has the articular surface for the ankle. The second largest of the tarsals.
So is the when you say the ankle, do you just refer to the entire region where the?
I'm saying your ankle joint, when you bend your foot up and down, that's your ankle joint that you're using to do that.
Okay.
And you're really not using anything else, at least unless I'm deluding myself. Okay.
Cuboid.
When you do a dorsiflexion, toe raiser, strictly ankle. Okay. Cuboid. So the cuboid is lateral. It's this great big lateral bone shaped kind of like a cube if you use your imagination. Okay.
And the navicular.
And the navicular is the medial one, long and skinny like the other navicular.
Can you show it this way, please?
Yeah. Navicular.
And then there's the metatarsals.
Okay, the metatarsals, metatarsal 1, metatarsal 2, metatarsal 3, 4, and 5. The metatarsal 1 is associated with the great toe. And the great toe has evolved into an organ that helps us balance, which when we were on all fours, it wasn't used for that. And animals that are on all fours have their phalanges are more, they all look alike, more alike anyway. You may have a larger one on one side or the other, but when we standing upright is real tricky. And we're constantly doing little adjustments, and the big toe helps in that. If you break your great toe, it's a huge injury, and you have difficulty doing much anything besides sitting watching TV because until You just don't want to put any stress. We use it in balancing all the time. You don't want to re-break it, even in a walking cast. I wouldn't advise walking a lot.
Are the metatarsals, are they with Roman numerals?
Yes, just
Okay.
like the carpals, metacarpals.
And there's the phalanges.
Phalanges that are named exactly like the ones in the hand.
So you want phalanx instead of phalanges?
Yeah, phalanx. So this would be the third distal phalanx right there, wouldn't it? Your other toes aren't so important. I broke one time. I dropped a weight on it. Don't ever be barefoot in a weight room. And all you do is just tape them together. But if you break the big one, boy, it's pivotal injury.
That's it.
That's all? What about the knee?
Oh, wait. Yeah, okay, ligaments, I didn't see this.
Okay,
We
yeah.
can skip the ligaments, don't worry. Leave them out next test.
So we got this really nice knee model, and we have my funky little knee model that I brought, which is kind of fun. The cruciate ligaments and the collateral ligaments are springs, and so you can see how they're involved in knee flexion. But this one is a really good one, and this is the one I'll ask you questions off of. And so, what is this, tendon or ligament? Tendon, okay. Okay, this is the quadriceps tendon and the patellar ligament. Attaches to the tibial tuberosity.
Lateral calcaneal fibular ligament.
I prefer to call it the lateral collateral ligament, but I'll accept the other one. These two ones on the side are the collateral ligaments. So we have lateral collateral because it's on the fibular side, and the medial collateral because it's not on the fibular side. Okay.
Can you turn it around a second?
Yeah. Medial collateral, lateral collateral. And here you see a nice articulation between the head of the fibula and the proximal articular facet of the tibia. Good model.
Then there's the medial deltoid ligament.
Oh, the medial deltoid, I forgot about those. These two ligaments down here are the ones you most commonly injure when you sprain your ankle. And they're involved with keeping your ankle stable. And if you twist your ankle, this one that's shaped like a little delta, a delta is a triangle, isn't it? So this is your medial deltoid ligament, pretty easy to remember. And the lateral calcaneofibular ligament attaches the calcaneus to the fibula. And it's on the other side, and it's also commonly damaged. So, okay.
I forgot the muscles too with that.
Oh, yeah, I knew that. Okay. Well, it could have fooled me, you know. So,
The tibialis anterior.
okay, tibialis anterior. And so, it's, yeah, the tibialis anterior is going to be, it runs adjacent to the tibia. It's this one right here. So it's the one that's probably the most anterior. Okay. And it's adjacent to the tibia, tibialis anterior.
And extensor hallucis longus.
Okay, extensor hallucis longus, we look here and we see the big toe and we trace the tendon back and it goes up inside there. And so to find the muscle, you have to take this off. And so underneath is the muscle, extensor hallucis longus is underneath here.
Could you turn that, please?
And, okay. So also, this is actually a better view of it. On the back side of this, you can see extensor hallucis longus, and it attaches to this tendon that kind of goes underneath and comes out and goes to the big toe. And remember, we talked about the crossing of tendons. So this tendon crosses the one that goes to the digits inside there.
So if you asked it, where would you point to?
I'd probably point to this. Take this off. You see me take this off, you know I'm going to ask for extensor hallucis longus. There's nothing else under there. Okay.
Extensor digitorum longus.
So the top part, the superficial part, is extensor digitorum longus, and it sends a tendon directly to the digits.
Peroneus brevis.
Okay, and so on the lateral side of the lower leg is the peroneal region, and we have peroneus brevis, which is this short muscle, and peroneus longus, which is the longer one.
That was the next one.
Peroneus longus, peroneus brevis.
Gastrocnemius.
Okay, so we've got to put this together. Remember, we said that the gastrocnemius was a superficial muscle that pretty much determines the shape of the calf. Has two bellies and all that. So that's gastrocnemius is what you're seeing now. Superficial, but the real bulk of the calf muscle comes from this muscle underneath called the soleus muscle.
Says it inserts onto the foot by
Yes, the Achilles tendon.
Yeah.
So these muscles work together, the soleus and the gastrocnemius are what, they're hugely powerful muscles, and we talked about this class 2 lever system here, and a huge amount of stress on this ligament attachment, the Achilles tendon or this ligamentous. You probably have to call it a tendon. And so you don't want to damage that. It's very important if you're a runner, you should replace your running shoes all the time, because you'll be putting big time stress on this tendon if you don't. You will be anyway, but less stress.
So which one's which?
Okay, so the superficial one is the gastrocnemius, and then underneath, if you take that off, you can see the soleus, which is where most of the bulk comes from. Thank you.
And then we have flexor hallucis longus.
So you take these two muscles off, which are the muscles of dorsiflexion, doing toe raisers. Dorsiflexion is a good word. And then the muscles underneath are the flexors, and when they contract, your toes curl down, which is a flexion. Okay. When the muscles in front contract, the toes curl up. Not very much, but a little bit. And that's why the ones in front are called extensors. Okay. So we have the one right in the middle is tibialis posterior. Okay. You've got 3 of them there. Okay. And let's see, actually this is tibialis posterior. Right there. Because this I was pointing to, that's peroneus longus. So here are 3 muscles that we're referring to as the flexors right there. Tibialis posterior is the central one. You'd expect, since the big toe is right here, you'd expect that this one would be flexor hallucis longus. Going to go to the big toe, guess what? The tendons cross. Okay, so this is flexor digitorum longus. It crosses underneath, and you can actually see it maybe heading over in that direction. And this one over here on the other side is flexor hallucis longus and controls the big toe. So you look over here and see the big toe, but the muscle on that side is the one that controls it because the tendons cross. So
There's tibialis posterior.
tibialis posterior is right in the middle there, the deepest muscle of the lower leg.
And then popliteus.
Popliteus, The popliteal region is the region in back of the knee. And there's a popliteal artery, vein, nerve, but we have this muscle right here is popliteus. So the popliteal region is the back of the knee.
And then we have the knee section.
The knee. Okay.
So there's the fibular or lateral collateral ligament.
Okay. I kind of like lateral collateral ligament, but you can call it the fibular ligament if you want. Whichever one you want.
And then there's the tibial or medial collateral.
Medial collateral ligament.
Followed by the anterior cruciate ligament.
Okay, the end. So if you open the knee up and look inside, it's kind of hard to see, but the ligament that attaches to the anterior part of the tibial plateau is the anterior cruciate ligament. When I open the knee up,
So it goes by the plateau connection?
yes, it's their name for the attachment to the tibial plateau. So this attaches to the anterior part of the tibial plateau, so it's the anterior cruciate ligament.
So the post.
It prevents the femur from sliding backwards. Okay?
So then there's the posterior cruciate ligament, which should be in the back.
Yep, the
Going
posterior
up to the-
cruciate ligament's in the back, and it prevents the femur from sliding forwards. Okay? Thanks.
And then there's the
Ooh.
lateral and medial menisci.
Okay, and each meniscus is made out of fibrocartilage, as we've said. They get beat up over the years, and that's why some people have to have arthroscopic knee surgery. It's basically repairing the two menisci. And they take on an appearance that's often described in surgical reports as white crab meat. Okay? That's how beat up they get. So they make three holes. One hole has a light and a TV camera. Another hole has a burr that can grind that stuff off, and a third one has suction. So they grind the fibrocartilage off until they get back to where it's healthy, and where it starts to bleed, they know they have a blood supply, and then they use the suction to suck all the pieces out, and they record it on video and show you what they did. Okay, and the light, of course, enables them to see what they're doing.
Is that arthroscopic?
Arthroscopic knee surgery, yeah.
So where are they located?
Pardon?
Where were they located? Can you point them out one more time?
The what?
Can you point them out one more time where they're
The
located?
meniscus?
Yeah, they're that.
Yeah,
okay.
there's one meniscus, and you see the other one clearly there. And they have a shape that is complementary to the shape of the condyles on the femur. Nestle right down into those concave depressions made out of fibrocartilage.
And we have the quadriceps tendon
Okay, quadriceps tendon,
and the patellar ligament.
patellar ligament.
And that's everything.
Okay, great, good job.
I was gonna ask, for the coloring book, do we color the